Chapter 1, Part 4, Anatomy, Physiology, and Disease Concepts You Will Encounter on Your Journey. So we're going to talk more about some of the terminology that's important in anatomy and physiology. First, let's talk about metabolism. Meta means change. So metabolism refers to all of the chemical operations and activities in the body. It requires various nutrients, chemicals, produces waste products. It's all life-sustaining reactions within the body. Now, metabolism being the overview and inclusive of all the operations or changes in the body, includes the ones that build things up and the ones that break things down. So there are two types of reactions or operations that occur in metabolism. One is anabolism and the other is catabolism. So anabolism is a process of taking simple compounds, building them up, and used to produce larger compounds that are used for growth, repair, and reproduction. It's the building phase of metabolism. So amino acids, for example, are the building blocks to form the more complex compound of proteins. So making proteins is a process of anabolism. Catabolism is a process where a complex substance is broken down into a simpler substance. So breaking down the phase in metabolism. So for example, breaking down food into simpler chemical building blocks for energy use. So we eat the food, it comes into our body, we break it down into its smallest nutrient substrates, it gets absorbed. So that breakdown process is catabolism. There are abnormal and extreme examples of catabolism. A starvation victim whose body starts to feed upon itself and actually starts to consume the body's own tissues. There are some other conditions where medications actually cause this to occur. And it occurs when a patient has diabetes, for example. Very important term to know, and we'll use this a lot, is homeostasis. Homeostasis is basically the body in balance. It's maintaining an equilibrium. Our body wants to be in equilibrium. So this is what we strive for with anatomy and physiology, is homeostasis. Our survival depends on the body's ability to maintain homeostasis. We don't want it too extreme. The homeostatic regulation refers to adjustments made in human organisms to maintain a stable internal environment. And if you think of this kind of like a thermostat in your house and how it controls the temperature, your body works the same way. It has a series of checks and balances, and one of the most important parts of that homeostasis is a feedback loop, which is called a negative feedback loop. What happens is a stimulus gets triggered in opposition of another effect in the body. So it's kind of a switch system. All right, so that's kind of confusing. So let's break that down just a little bit. So like in your house with the thermostat, when it gets too warm, your air conditioning clicks on. When it's cooled down, the air conditioning clicks off. So that's a negative feedback. So in our own body, our hypothalamus, which is a gland in our brain that controls our body, is that thermostat. It's that temperature control. So if our body gets too hot, it sends messages to the rest of our body to help it cool down. If our body is too cold, it sends messages to our body to conserve heat. So this nice illustration in the book kind of talks and takes us through what that means. So at the top with the hypothalamus, we're sweating. So what that does, if we're too hot, we sweat. When water gets on the surface of our skin through sweat, when air comes in contact with the water, it will evaporate it, and that will help cool down the surface of our skin. That's called evaporative cooling. and then it helps bring our body temperature back down to normal. Now, if we're cold, we need to protect our vital organs and make sure that we have warm blood to keep those operating properly. So we want to conserve that blood flow. So when we're cold, we want to take the blood away from the surface of our skin. The blood vessels will constrict and keep that blood more internal. When it does that, it snaps our pores closed. It makes our hair stand up on end, kind of like goosebumps. And then we get the blood to go to our brain, and it tells us, okay, we're warm. Now, if we put on a jacket or a blanket, that also helps to return our body back to a normal temperature. Shivering is another way for our body to make heat. So these are all normal processes that are triggered by that thermostat in our head called the hypothalamus. Now there's another system called a positive feedback. Now positive feedback just keeps pushing forward. It's often known as a vicious cycle. It just keeps increasing the magnitude of change. It doesn't maintain homeostasis. It doesn't have a balance switch. Now, sometimes if a process has been completed, like the book talks about labor and delivery with oxytocin being released and causing contractions, once the baby's born, then other chemicals are released in the body and it will balance that out. The challenge with positive feedback is it could be very harmful if we can't break the cycle. So if a woman continues to have contractions after she delivers, she could actually have a rupture in her uterus. Another one is a thyroid storm. So if all of a sudden your body's making thyroid hormone, which it's supposed to help maintain metabolism, but it just keeps making it and it doesn't want to shut off, that would be a positive feedback critical component. Now, talking about disease concepts, when we talk about illness and disease, patients will often talk about signs and symptoms. So understanding this terminology is important. So a sign is something that's definitive, it's objective, it's got no perception component to it, something that's measurable. So fever, we can take somebody's temperature and know if they're running a fever. If they have a change in the size of a mole, that can be measured. If they put on weight, their respirations, their blood pressure, those are all things that can be measured. Swelling can actually be measured. We can use a tape measure and determine is something swelling. Now, vital signs are those things that can be measured that are important to sustained life. So pulse, blood pressure, temperature, and respiratory rates are all considered to be vital signs. So we want to make sure they're breathing, that they're not hypothermic, that they've got the proper blood pressure, it's not hypotensive or hypertensive, and that their heart is beating, they have a pulse rate. Now, symptoms are subjective. These are things that it's a perception by the person. So it can't really be measured to a true scale. Now, pain, we do have some pain measurement scales, but again, it's that person's perception. Some people are very tolerant to pain, and some people are very intolerant to pain. They could have the exact same, let's say they broke their arm. If you're intolerant, you're going to be in a lot of pain. If you're very tolerant, it may be achy to another person. So that's just an example. Dizziness, itchiness, nausea, how nauseous are you feeling? Those are all something that it's a perception by the patient. Now, when we talk about disease concepts and we put together a group of signs and symptoms that are related to a specific disease, that's known as a syndrome. So we have Reye syndrome, which can occur when somebody has a viral infection, like the varicella virus, and they take aspirin, it can cause a syndrome, which has a certain set of symptoms and signs. Stevens-Johnson syndrome. It's kind of a hypersensitivity reaction to certain medications. Your book talks about the symptoms and signs of Down syndrome. So again, a syndrome is where there's a group of signs and symptoms related to a specific disease. Now, in determining what the disease is, that's known as a diagnosis. So we're able to identify the disease by the patient's signs, symptoms, the history of the patient, and results of diagnostic testing. So if somebody has flu-like symptoms and they've been in this area of Miami, they may be looking to see if they have Zika virus. So they would have to do a blood test to have that diagnosis. I know usually in the summer we'll hear about West Nile virus. We haven't heard much about that this year. The flu. Do you have just a cold or do you have the flu? So different sets of what's the patient's temperature, what are the symptoms, where have they been, who have they been exposed to. So those are some of the things. Now that all starts when the patient sees their primary provider and they talk about their chief complaint. They come in and they say, oh, I've got a headache and I'm achy and I'm runny nose and I'm coughy and I got a sore throat. Now, if the doctor looks in their throat and they have white patches on the back of their throat, the doctor may take all that into consideration and think, this patient may have strep throat. So they won't make a definitive diagnosis until they do a swab of the throat and send it to the lab and find out that that's actually strep throat. So the more details they are, the easier it is to make that diagnosis. Now, once a diagnosis is made, then a prognosis can be determined. The prognosis is a determination of the outcome. So, if somebody's got a cold, the prognosis is that they'll be under the weather for probably about a week to 10 days. The flu, it could be longer. Of course, with a more serious condition, then prognosis is a more weighty concern. Now, when we talk about serious or I don't want to say not serious, but limited conditions, we have chronic and we have acute. So a chronic condition is generally a gradual onset of symptoms over a long period of time. The condition lasts for a long period of time. It may resolve or it may be something that is lifelong. An acute condition is usually a rapid onset of signs and symptoms, and it usually will only last a relatively short period of time. So the flu is acute. Hepatitis C could be chronic. Those are both viral infections, but they have different outcomes. So acute, short-term, rapid onset, chronic, long period of time. Now, when a patient has a chronic illness, they often will have times where they have no symptoms. So that is known as remission. So the symptoms may appear to disappear. Now, if those symptoms come back, that is known as a relapse. Cancer. If a patient has had treatment for cancer, they may have a cancer-free period of time, which is known as remission. And if that cancer comes back, then they would have a relapse. Now, other terms like exacerbation are things that are flare-ups or signs, or sometimes situations or medications that could cause a relapse or a flare-up. Terminal disease is one that has a prognosis of death. So the patient is never going to recover from the disease, and the disease itself is potentially going to cause that patient's death. So an example of terminal disease, of course, would be cancer, but ALS is another. MS in its later stages, and even Alzheimer's disease could be considered terminal diseases. All right, now it's time to test your knowledge again. Which of the following are vital signs?